Prescriptions written by your doctor may soon include a smartphone app. New apps designed to help patients manage medical issues and get information back to their doctors are being developed by hospitals with the hopes they can be easily integrated into patients' daily lives. Here to tell us more is WSJ Assistant Managing Editor Laura Landro and Dr. Joseph Kavidar, Partners Healthcare Connected Health Vice President. Welcome to both of you. Thanks for being here. Laura, let me start with you. What kinds of information are these apps meant to collect?
Well, these are not the apps that are like your Fitbit or did you run 5 miles, although certainly there are things like that. These are apps that are dealing with patients who have very specific issues and they're trying to avoid having them be hospitalized or go to the emergency room. So maybe you're dealing with cancer pain or you're dealing with inflammatory bowel disease or you've just had breast cancer surgery. And there's a lot of things you have to do when you leave the hospital or the doctor's office, but you don't always have a lot of support to do it. And the idea is the app will allow you to input information, and it isn't just in a vacuum. A lot of that information is going back to the doctors and to your clinicians who are looking at things and monitoring to see if things are getting to a point where you need to come in.
And it should be convenient, right?
Yes.
That's the idea. So, Dr. Kavidar, tell us about the apps you are testing out at Partners Healthcare System. What kinds of results have you gotten so far?
Well, we're really breaking new ground, Tanya, because the goal here is to take us out of the thinking that you need to go to the doctor's office to get something done in healthcare and make it more of a continuous function in your life. Just as Laura said, we're taking fairly specific indications and trying to build into that wonderful mobile device that you carry around in your pocket the capability that can allow you to take better charge of your care and allow us to intervene when necessary. Probably the best example is one we've just completed the research on for helping patients with cancer manage their pain better. This is a really tough problem. The oncologist all but only has the time to give you a prescription and say, you can take 2 or 3 of these every few hours as long as you're in pain. And of course, patients have all kinds of worries about addiction. They don't understand fully how to use these medications, and sometimes they unfortunately go through a lot more pain than they should. So the app that we developed really takes them through step by step, interactively, how to manage their pain. It takes them through several algorithms. It does enable them to get in touch with our pain management service if they can't solve their problem on the app. But I'm happy to say that most of the patients that we put through our clinical trial on this not only had better pain management scores at the end of the study, but they didn't really use the function to connect very often to the pain management service. And that was part of the goal, was, as I said earlier, to empower them to do better for themselves.
Absolutely, but it's also a testament to the apps being well-designed and sort of easy to manage. I would imagine, Laura, that these will catch on. Do you see a sign of that?
Well, what I see is, these might not necessarily be the, giant billion-dollar things that are coming through your app stores and things like that. These are really in the medical community. These are being developed by hospitals and health systems. They're not something you're going to download, but they're something that is really going to help in patient care. And they're already seeing evidence that this is reducing hospitalizations and emergency room visits.
Right, which is, I guess,
that they can be cost effective then.
Right. Doctor, is this the end result? What are you hoping to achieve with these apps?
Well, we don't want to leave anyone with a message that we don't want you to have a relationship with your doctor or that we don't want you to come into our facilities when you're sick. But we do, as I said earlier, we want to make your care a continuous part of your life so that you are constantly in touch with your care goals, with your health goals, and you can move that forward using this wonderful mobile technology by interacting with little software apps on the device. So yes, there's a goal to be more efficient with our resources. That is to say, we don't want to admit you when we don't have to. We don't want you to come in the office when you don't need to.
Right.
But the overall goal is to have your care be a continuous function in your life as you go throughout life.
It also seems to me, Laura, that these could be an economical way of dealing with treatment. I mean, if you can get a lot of information and a lot of answers from your smartphone app, that saves a lot of time and money as well.
Well, yes. I mean, some of these are designed so that, for example, with cancer pain, one of the things that Dr. Kavidar was talking about, they actually push you messages. If you start showing that your cancer pain is increasing, or if you start expressing through the diary notes, I'm a little worried about the addiction issue, they can push you a little message or a little video that says, you know, this is the difference between addiction and increasing tolerance.
Right.
And just kind of educate you a little more and give you those tools that you need to deal with this on your own, in concert with your doctor, though. It's always in concert with your doctor.
Of course.
You're not out there on your own.
The crucial element, of course. Laura Landro and Dr. Aguiar, thank you so much for being with us.